Hello, everyone. Welcome back to the second session of the day. As always, welcome everyone to the Embodied Lab 1 Day Summit on Psychedelics and Trauma Healing. My name is Oyemi Kalimaat, and I am zooming in from Monacan Land, which is colonially known as Buckingham, Virginia. And I'm on the East Coast time, so it's 10:49 a.m. for me. And this is our second session of the day, Embodied Journeys, Somatic and Trauma-Informed Mindset for Psychedelic-Assisted Therapy with Manuela Mischke-Reeds. And as our community gathers today from various corners of the globe, we would like to acknowledge that the land we live and work on is the traditional territory of many indigenous peoples. We respectfully honor their people, cultures, and tradition. With that, if Liv could please spotlight Manuela so I can read her bio. We're gonna put her longer bio in the chat, but I saw in the bio, but before I even read her bio, I want you guys to know something. I have been a part of the Embody Lab community for about 2 years now, and there have been a handful of people that truly, truly, truly inspire me, and Manuela is one of those people. So I hope that you guys get to see what I've been exposed to these last 2 years in her brilliance and her care and her mindfulness and just how delicate she presents this information and this content to all of us. So with that, Manuela Mischke-Reeds is an international teacher of somatic psychology, somatic psychotherapist, a founder of Hakomi Institute of California, and Embody Wise, a nonprofit that cultivates learning from the wisdom teachings of the body. She is the developer of the Innate Somatic Intelligence Trauma Therapy Approach, ISITTA, and it's an in-depth trauma training program for therapists and practitioners. So again, keeping it short, but we're gonna put the longer bio in the chat, so feel free to read her bio because she is quite brilliant and you will get to experience that today. So with that, Manuela.
Oh, thank you, Ayami. I wish we had those times when you were my demo person and you were doing these beautiful movements. Ayami is such a beautiful mover. So if you take other classes or if you had the pleasure to see her move, she's a gorgeous dancer and mover. So thank you for being here. Thanks for Embody Lab for having me here again. And thank you all for being here together at the summit. I'm very excited to be talking to you about embodied journeys, somatic and trauma-informed mindset for psychedelic-assisted therapy. I will make it often short when I talk about psychedelic-assisted psychotherapy. I will call it PAP sometimes. So just if I throw the word PAP around, then you know, oh, that's what she's talking about, because it's a mouthful. Psychedelic-assisted psychotherapy. It's a lot. So PAP. So I'm really delighted that we have this time here together. As Oyami was saying, I've been a psychotherapist and somatic psychotherapist for over 25 years. And I live in the Bay Area originally, and that's where I do my work. That's where I teach and practice. Right now, I'm calling you from France. I'm on a short trip here, and I'm calling you from the beautiful countryside here, escaping the heat. And in the last 25 years, I've had the delight and pleasure to have a very close relationship to the psychedelic work because I've done a lot of integrative work with clients who've done psychedelic work. And in the last few years, I had also the pleasure to do work with first responders using ketamine, so CAP, ketamine-assisted psychotherapy work. So my talk here today, or my presentation today, is really about doing some offerings from the somatic world that I think are uniquely suited to help therapists and guides to be assisting this beautiful PAP process. I think that somatic therapy has something unique to offer. As you know, the psychedelic field is just such a rich, beautiful field of research and therapies and investigation and practice and indigenous practice, a long, long lineage already, way before we have been now coming on the scene in the West, a rich tradition. And we all have beautiful offerings to give, and we're all trying to figure out how do we use these powerful medicines working with a variety of ailments from anxiety, depression, and trauma. My field is a lot of trauma work. I've been a trauma therapist, worked literally a whole range with trauma clients, and it's my kind of passion to always find what really heals trauma. It's been my inquiry for literally 30 years. I keep asking the question again and again and again. And the more I know, and the more I practice, and the more I treat, and the more I teach, the less I know. And I don't say that to be facetious here, but it's really that the more we look into what really heals, it's truly a mystery process. And the beauty about psychedelic work is that it invites us into the mystery process, this frontier of how do we access our own innate knowledge, our own innate wisdom. And that's, I think, why it's so powerful. So what I would like to do is I'd like to, in this hour that we have together, and please feel free to post some of these chat questions. I love questions. I don't get thrown off by them. I will cover a couple of things I'd like to cover, and then I'll definitely will field your questions. That makes it much more lively, what's really here in the room. But I would like to take a look at what the role of somatic interventions in particular are for this developing field. And I also like to look at how therapists and guides can prepare specifically for the emergence of trauma and body memories, because that happens quite a lot in psychedelic work. And in fact, a lot of people who are battling depression, anxiety, and trauma are often turning towards psychedelic medicines because they feel like that some of the other therapy modalities are failing them, or just getting them to a certain point, but not really helping them to truly process the trauma work. So I'd like to take a look at that. What can therapists and guides do when trauma and body memories surface? Now, this is a huge topic. This would be literally a year-long training, but I'd like to give you some cliff notes on that, how I think about it. And then in particular, I like to take a look at how somatic therapies, and my wheelhouse is really Hakomi therapy and somatic experiencing and other somatic modalities. I come from Hakomi, I teach Hakomi, that's my home base, but I've been trained in many somatic modalities, and I'm a big supporter that a lot of somatic works need to come together to heal trauma. One of my discoveries on my inquiry of what really heals trauma is that there's no one modality. We need many, many modalities and tools in our toolkit to truly help to alleviate the suffering of trauma. I like to take a specific look at what I like to call somatic set and setting. That's set and setting is a word or two words that get thrown around a lot in the psychedelic work. So I like to take a look at that, what that means from a somatic perspective. If we have time, I'll do a short little experiential exercise looking at what it means to be in a somatic attunement when in an expanded state. Expanded state is another way to describe a psychedelic space. So let's take a look at the role of somatic interventions in the field of psychedelic-assisted therapy. By nature, and I'm not highlighting any particular medicines, right? By nature, so there's a whole range of different medicines, and they all are very particular, and there is a huge knowledge base with each one of them. But by nature, the psychedelic work is highly experiential work. It's highly experiential. It's also highly somatic for a lot of people. Not for all people, but some medicines in particular can be experienced very somatic, meaning body-based. Soma, if you're new to somatic work, soma means the body. It's a Greek word. And when we talk about somatic, we're really meaning that it's how do I sense and feel it in my body. And these are nonverbal experiences. These are nonverbal cues that I receive from my body. And the ability to understand my own nonverbal cues, and then for a therapist to read those nonverbal cues, really needs the training of a somatic therapist. So when we're talking about psychedelic work, we're talking about a very internal experiential state that gets accessed, an expanded state, in which we no longer have the cognitive functioning how we usually have it in therapy. We're not really able unless there are certain dose ranges that are lower, and some medicines it's more possible than others for sure. But most of the time, if you're doing a full dose session, you're going into the psychedelic range, the client is not able to express themselves or verbalize the experience in the usual ways. So often movements, sensations, felt sense, cues from the body, comfort and discomfort, are need to be read by the therapist in an accurate way. And so this is where somatic interventions can be very powerful, because the somatic therapist is trained to do exactly that. You know, you're learning how to read the body like a map. You know, when the head moves to one side or the eyes cast to another side, or that it has a particular meaning. And we can extrapolate often how the internal state of the client is progressing. If the breath is labored, for example, or if there are short bursts of breath that somebody is gasping for air, we can extrapolate that there's maybe a certain distress happening in the body, and therefore we can tailor our interventions accordingly. It's often very difficult to ask the client, how are you doing? Sometimes they can answer, sometimes they won't answer, and sometimes they don't even know how to answer because of the expanded states that they have accessed. So the ability to read these nonverbal cues becomes truly an art. And as a guiding therapist, we want to be in the position where we want to make the medicine journey as comfortable, as safe, as embodied, and as meaningful for the client as possible. At the same time, we also want to allow the client to go through their process without much intervention of what is organically unfolding. So there is a very interesting tension, and that's very true for somatic work in general, is that we want to allow our client to have their experience, basically, and we're trusting that experience. And at the same time, we want to make sure that the client has a safe and contained experience where they don't get overwhelmed or frightened by the experience, even though they might confront a very scary or even traumatizing experience. I'll talk about that in a minute further. So the ability to guide a highly experiential experience is one of, I think, where somatic work can be very, very helpful. And then also to prepare the client how to even enter into a psychedelic space with somatic breath work, with getting comfortable in sensing and feeling the body, knowing actually what discomfort feels like, what dysregulation feels like, and how to come back to regulation. So all these internalized, embodied experiences become extremely important when somebody is in an expanded state. It's kind of a little bit late to do that when the person is already in an expanded state. So I often talk about how important it is to basically train the client who wants to go do PEP work, that they need to have some repertoire, some basic repertoire in somatic work, so that they actually have a very meaningful, in-depth, and safe experience, for them safe. And that's very subjective, by the way, for them safe, so that they get the most out of that work. As you probably know, psychedelic work is often rated as one of the top 5 experiences in somebody's life, the most awe-inspiring, life-changing experience. So you want to make sure that if you're in the position to legally guide somebody in this work, that you want to make sure that they're very safe and that they have an awe-inspiring experience, even if they're meeting their trauma. And I'll talk about that specifically about trauma in a moment. So because trauma lives in the body, trauma is actually a bodily experience. As soon as we tune into our present moment experience, we can feel triggered in the somatic memory of the trauma. And these reminders of trauma are very true in the expanded state. Visual images, fragments of memory can feel like flashback, actual memories, imagery that is kind of memory based, but can be kind of vivid imagination. The synesthesia of some of the medicines, especially psilocybin, can trigger highly somatic states in the client of discomfort, fear, and terror. Now, the beauty about with, especially in the, you're probably all familiar if you haven't heard about it, but MAPS has been doing a lot of work with MDMA in clinical trials. They're now phase 3. And they have been focusing a lot on how to use the efficacy of MDMA with trauma, especially veterans, and have found that there is a reduction about 68% in the subjects of their PTSD symptoms 6 months after the completion of the treatments, and for most of these participants a year after, which is a very impressive number to get. Really, we don't get that with any psychotherapy. Even the most sophisticated psychotherapeutic and pharmacological combination, we often do not get those kind of results, and this is why this field is so incredibly promising. So what happens is that in the PAP experience, the activity in the brain's default mode network actually decreases. So there's reduced activity. And when we have trauma experiences, our default network actually gets increased. And so different brain regions begin to talk to each other. So the neural networks that involve especially our amygdala, you probably have heard about the amygdala. It's the seat of our emotion. It's also where we, along with the hippocampus and the insula and the cingulate, is where we store traumatic memories. And even in a somatic therapy, if we're doing somatic experiencing or Hakomi or other wonderful therapeutic modalities, when we regulate our client into a resourced state, you probably have heard some of these terms, often when clients are truly in the grips of their trauma activation, this does not last very long, and they might get catapulted out of this regulated states very easily. What happens with some of these psychedelic medicines, and this is the study that MAPS is doing with MDMA, is that the areas of the brain, of the neural networks, they actually decrease in their function, and they don't light up basically as intensely as they would do in a regular therapy session. Why this is so revolutionary is that that means that the triggered client is not as triggered. Plain English. They're not as triggered. And so they're able to tackle a memory or a feeling or a state, because trauma is encoded in literally a bodily state. They're able to access that state without getting overwhelmed or flooded, which is what every somatic therapist battles when they're sitting with a trauma client. You can get your client very regulated, very calmed, very soothed, and then the slightest little trigger can actually activate that, because our brain is wired towards safety all the time and looks out for potential perceived danger. So when I look out for perceived danger, I need to basically engage all my fight, flight, freeze systems, and then my client is triggered again. In the psychedelic expanded state, the medicines regulate these neural networks down, decrease some of this activity, and the client can actually engage with some of these feelings and traumatic experiences in a safe and engaged way when there is enough safety in the set and setting, which I'll talk about in a minute. So this is very important for the trauma work. And this again is where trauma work, somatics, and psychedelics intersect so beautifully, because we need to understand when is our client getting regulated up, when is their heart rate going up, when are they having the classic symptoms of trauma activation, and then how do we come in and help our client to both engage with the experience in a safe and engaged way so that they can process the trauma through. One of the challenges that we've had in somatic therapies, trauma therapies, is that because many trauma clients are so activated, is that they we tend to have a bias towards resourcing our clients a lot. So the client gets activated, they get fearful, they have a trauma memory coming up. We, rightly so, begin to offer our client a kind of soothing, regulating, co-regulating menu. Let me unpack this a little bit for those of you who may be new to these terminologies. So When client gets activated, has a traumatic memory, and they're remembering something terrible, their breath might get very short. They might have a feeling of fear. They might have a tension in the body. As a somatically trained trauma therapist, we would immediately in that moment offer them an option to regulate the state. So we would say, so notice what's happening in your body right now. How about I offer you a breath here, or can you feel your feet on the ground, which is a resourcing technique. I'm offering another somatic state to counterbalance the activation. Another way, I might be interrupting that state so that the client gets their prefrontal cortex back, because what happens when somebody gets activated is their prefrontal cortex activity of understanding their own experience actually gets interrupted. And thirdly, I might offer the therapeutic connection. Why don't you connect with me? I might say to the client, yeah, what's it like if you look at me? Well, you look like a friendly face. I feel it's okay. As you look at me, what happens in your body right now? Well, there's a little bit more breath. That feels a little safer. That was really scary what I just tapped into. That's what we refer to as co-regulation. There's a whole field of polyvagal theory informed, and that's a lot of what relationally based therapists are working towards, that they're using the relationship, the safe therapeutic relationship, and the calm, regulated nervous system of the therapist to co-regulate the other person. I'm seeing in Anthony's picture right now, a cat walking through the picture, which is lovely. So the cat is regulating Anthony, and I can't see your name there, but it's regulating you too. And that's what mammals do. What mammals actually regulate, yeah, there you go. I love the cat, the tail, the happy cat. What mammals do is they regulate one another. It's beautiful biology here. Yeah. So when you're with a good friend, a close partner, and you get scared and your partner reaches over and puts a hand on your shoulder or gives you a hug, they're co-regulating you. Yeah. When you get a little anxious and your cat crawls on your lap, or your dog comes and leans up against you, your mammal is co-regulating you. This is what we do as humans. We co-regulate all the time. Yeah. And part of relational trauma is that we often have received not enough co-regulation. This is in the whole ballpark of attachment, wounds, and trauma. So when we work with trauma memories in a non-expanded state, what the somatic therapist will do is we'll build a repertoire and try to teach the client by helping them to teach them tools, regulating tools, somatic breaths, movement, and so on, a whole repertoire to help them to interrupt that state. Because what we don't want is for clients to re-encode into their nervous system, into their default network, the same overwhelming, traumatizing, horrifying experience. Trauma therapy is not about reliving your trauma. This is really important. Trauma therapy, healing, is not about reliving your trauma. It's about visiting the state in which it was encoded with new information. You want to visit the state, but you want to bring with you some good tools. Yeah? This is why in the trauma therapy world, we talk a lot about the resourcing, the regulating, the bringing people back into a more safe internal space. This is why nature is so powerful for many trauma survivors, because it regulates us, right? Breathing next to a tree, sitting next to a body of water, right? Being next to a friendly mammal, all of that, being in a big sky energy, being in the water, surfing. I mean, you talk a million ways to how our body learns to restore the nervous system. Now, here's the interesting thing about psychedelic work. Often, many times, these trauma memories do come up. And left alone, we can have what's often called a bad trip. Because what really matters is how we enter into the PEP work. So this is referred to as set and setting. Set and setting, which is really the original term, comes from, believe it or not, from Timothy Leary. And it was talked about set. And this is really about how the mind is being preserved for the journey. So how do we enter into the psychedelic work? What kind of state of mind do we have? What intention? What preparation? How do we enter into with our mood, our beliefs, our perceptions, and also our beliefs around spirituality and religion? All that is part of the set of how do we enter into it? What do we bring into the psychedelic work? Setting is everything that's outside. So it's the people that I have around me, the music, if I'm in nature, if I'm in a clinical setting, if the bed that I'm lying on is very comfortable, if it's soothing music, if it's a beautiful, safe space, or if I'm in a club. That's not an ideal setting to do psychedelic work for therapeutic, especially for trauma recovery and healing. That's not a very good setting. Just for all the reasons I was just mentioning. I know that a lot of people do recreationally psychedelic work, but many people, and this is quite a bit of clients that I've worked with as well, come in and say, yeah, I tried it, but then it was a really difficult, bad trip. And there's some people that say there's no such thing as a bad trip, but for trauma clients, there are bad trips. Because it's what's missing for them is in therapy, the safe container. And that set and setting that's not done appropriately, safe enough for them to go through that journey and meet those struggles and those traumatic memories in a new way. Remember, I said that trauma healing is about meeting the trauma and with new information and new experience. So when somebody has a setting that's not safe, that's not with the right people, and is in a setting that feels unsafe to begin with, and has maybe not a very good intention to go in with it as well, then the trauma client has a high potentiality to get actually re-triggered in the trauma and has the same outcome. And that's actually can be very, very challenging in terms of the healing. I like to refer to also a set and setting as somatic set and setting. And what I mean by that is what the somatic set means how the internal client's capacity is being trained prior to going into the psychedelic work. What's their capacity? Have they learned to allow an experience? Have they learned to meet a discomfort in themselves? Have they learned how to regulate their nervous system? Have they learned how to trust a somatic experience that they had no control over? Have they had a breath experience or a movement experience that made them feel, quote, weird or expanded or unusual or not knowing what this is? And can they trust that experience? This is all a somatic skill set that I believe as a somatic therapist is essential to actually give our clients before they even get into an expanded state experience, especially with trauma. Because the client, once they get into that experience, they have a nervous system knowledge, they have trained it, they have a memory of that on a physiological level, that, oh my gosh, here comes the trauma, here comes this horrible thing that I actually didn't want to remember, and here it is squarely, and I'm terrified. They have the help of the medicines that's decreasing their neural network, the default network. But now you also have the somatic set, the internal capacity to trust this experience. And that's a very powerful combination. Many clients that come up against difficult, challenging experiences have a difficult time relaxing into it. They're tensing their body. We want exactly the opposite. Relaxing into it is often an instruction that a therapist will do. Trust this experience. See if you can take a breath, exhale, right? We're often encouraging more the soothing, calming, relaxing repertoire of the body. But if the client has been trained prior to actually have a knowledge base on a somatic level, it will be remembered in that moment. And it's a very powerful resource that's already installed. Somatic setting, I like to refer to as how the therapist is resourced and regulated within themselves during the work. Depending on the kind of medicines a therapist uses, ketamine sessions can be shortish, a 2-hour window, and psychedelic work or MDMA sessions can be longer, could be many hours. It means that the therapist needs to have, in the clinical settings, there's often 2 therapists because of that, and it's a recommended, for some therapies, recommended protocol, partly because it's very long, but also to stay present and regulated within your own nervous system as your client journeys through these expanded states can be very challenging, both in terms of having the attention, the presence, and then working with your own triggers. So when I talk about somatic setting, is that the therapist needs to learn how to be resourced and regulated within themselves throughout the work. And that can't happen just on the fly. This actually is training. This is literally training ground. And so then the therapist knows when they're getting triggered themselves, because again, so much of the work is nonverbal. I need to be able to read my own internal somatic experience, to intuit and have an educated hunch of what's going on for my clients. The client might not be communicating, but I might have an intuitive hunch, right? And I can get that because my soma has been cultivated and trained to read that. So that's what I mean by somatic setting. In an early study where they began to study anxiety in a clinical setting, in a CAP setting, they were studying that when there were no mental health practitioners available, and it was done more in a clinical way, the early CAP work, as a ketamine work, was done very clinically with a drip and basically sitting in a nurse's office. And there wasn't much of an encouragement of going through an experiential and journey-like experience. And what they have found, that patients with anxiety were suppressing their anxiety and were battling the psychedelic effects of the ketamine because they were basically torn because the set setting didn't feel safe to them. So in a nutshell, if you don't feel safe internally, if you don't feel safe externally, if the container is not held right, and if the therapist is not sitting in their own somatic grounded set and setting themselves, it is acutely felt with a client that's in an expanded state. And they're beginning to battle their own experience. They're trying to control it. They're already having a hard time, or they're going through experiences that are maybe unusual, unfamiliar for them if they're not used to it. So this will add to more stress, actually, and will add to not a very desirable outcome. So the set and setting is incredibly important. And again, this is where somatic work can be so potent because it trains the therapist and the guide in their presence, in their skill set, and in how to read the client's experience. That's often not very, on first, if you're not trained somatically, very difficult to read. So let me pause. I've been talking for a while. Let me pause and see. I have a very small window. So I want to see if there's any questions. So Yami, is there anything?
Yeah, we have a couple of questions in the Q&A. Let me see. This is from Brittany, who said, would it be fair to say that psychedelics lower the critical factor in order to allow the person to understand and adopt new positive thoughts without automatically shooting those new ideas down as when the critical factor is up and working?
Great question. Yes and no, depends. So yes, one of the beautiful benefits of psychedelic work is that you are invited into mystical experiences, unusual experiences, new thoughts, new configurations of thoughts. Entire regions of the brain get fired up, especially in high doses. They get fired up, and new neural connections are established. But here's the important part. There is a critical window, depending on which study you follow, between 24 hours and 1 week after. There is a neuroplasticity of the brain. We have neuroplasticity with any new novel experience. So I'm in this beautiful countryside of France right now, and I'm having some awe experiences every day. Yeah, it's very pretty here. I'm in the mountains. And so the experience of awe induces a novel experience. And so when we will not forget it, right? We won't forget adverse experiences, traumatic experiences either, because we need them for survival, evolutionary speaking, because we don't want to be again in that difficult experience. So we remember it. But equally so, we remember awe-inspiring experiences, and they do bring with them a neuroplasticity. And with psychedelic work in that 24-hour to a week-long range, there is that beautiful neuroplasticity. And some people even talk about it like you have, for a short time, you have a childlike brain. 0 to 3 with children's development, we have this incredible explosion of neural connectivity. And any of you who've been around young children or have young children, a young child, an infant, a toddler, everything is novel, right? They put everything in their mouth, they run around. It's like, wow, ice cream, right? Wow, a stick. Wow, this. And so all these novel experiences create an explosion in the brain and create neural connectivity, which is fantastic. Well, schooling starts, remember schooling? And then we get neural pruning. So our neural connectivity reduces, which we need because we need to be more efficient in our body function and our thinking. We get more, we can say more rigid, but we get more higher functioning, right? And our neural connectivity reduces. So that childlike, wow, awe, wonder, newness, anything is possible, everything is considered, kind of reduces. That window opens again in fantastic teenage years. Remember those? If any of you remember your own, or if you're raising some, there is another explosion in the brain. And we go, who is this human becoming when they're going through those years? I've just survived it with my teenagers. And then again, the brain gets more patterned, basically. So there's these incredible windows in the human development where these windows open up. And we have this incredible tool called psychedelics, where this window opens up again. So now we have this horrible thing called human habit and behavior. If we do not strengthen those new neural patterns that we have just so beautifully experienced in the psychedelic work, if we don't create new habits, integrate, the word is integration. This is why the buzzword you might have heard in psychedelic work is so much emphasis on integration. If we do not integrate this new thinking, understand our experience, really work on it to create new habits and use that beautiful window of open neuroplasticity, if we don't do that, it will have an effect, but it pretty soon will go back to our nicely ingrained habits. So there's a lot of still, and there's so much we don't know. We are just at the beginning of really understanding and researching, but right now, this is what a lot of the thinking is. And anecdotally, I can tell you that some of my clients who've done psychedelic work, they do it, but then they go back to their old patterns, and then they wonder why their life is not changing. Anybody can have a psychedelic experience, but then what you do with a psychedelic experience is really the critical factor in terms of trauma healing and therapy. There's a difference between psychedelic experience and using psychedelic experience for trauma healing and recovery and really changing your life. And that means that you need to use that critical neuroplastic window in order to support these changes. So if somebody has a big insight or they have a new feeling that they're discovering, the trained therapist will encourage this client to take up some practices. Again, this is where somatic work can be very helpful. Let's practice this breath. Let's, open up this window even more with some of these breath practices, these movement practices. See if this week you can create this new habit of another habit, of a habit that you did before. See if you can change that. Go to bed earlier or change your diet. Or there's so many, there's so many different ways that you can help your client there. But what the critical piece is, you want to use that critical window of the brain's incredible neuroplasticity and connectivity to install these new thought patterns, habits, and behaviors. So sorry, it was a very long answer, but it's a really great question because the medicines alone will not make the change. And this is why in the psychedelic work, you need to have psychedelic work and therapeutic work supported one another. And that's where you really see the big change. Yeah. And in fact, I would venture, because I've seen a lot of clients that have done psychedelic work without much guidance and then actually got very, very stuck because they did not do the integrative work and it fragmented them further. And it created more anxiety, and there was not much change and progress happening. And then they basically threw away the baby with the bathwater and said, well, psychedelics don't work. It's not that psychedelics don't work, it's that the proper guidance and the proper instruction, the proper integration needs to be supported in that work. Any other questions?
Yeah, we have one that's been upvoted 3 times from River. I'm curious about how long it takes for a client to be trained in the somatic skill set. Is there a minimum amount of time sessions you have noticed in your own work?
For somebody to be trained in somatic work?
Somatic skill sets.
That's a really good question. How much time do you have? um, so, I mean, I can tell you that, most somatic therapy training, such as Hakomi or somatic experiencing, they're all between 1, 2, and 3 years long. A really reputable somatic training will do that. I mean, there are basic somatic trainings that you can do, and you can get a lot of skills, but then the true work really begins in applying the work to clients and then getting supervision. I've been a somatic therapist for, as I said, for over 25 years, and you can ask a client to feel a breath. There's so many beautiful techniques out there. But then guiding somebody effectively through the somatic experience takes a lot of art and skill and presence and reading the situation correctly. So anybody can say, do this breath, or how do you feel in your body? Those are kind of standard somatic techniques. That's okay. But then the client goes on a journey. Forget the psychedelics for a moment. By actually bringing somebody into their internal experience, they go on a journey. And facilitating the journey is really difficult, because what comes up? Saboteurs, trauma parts, triggers, fear, anxiety, depression, internal parts that are at war with each other. A whole internal psychological configuration emerges that are tied into physiological states. And so to guide somebody through that it really takes a lot of skill in helping the clients to understand the experience, trust the experience, and then also applying new pathways to the experience. So it does take a good amount of time the tools are not that complicated, but applying them to your clients and reading the therapeutic relationship correctly, that takes a long time. Because guess who's the biggest obstacle in a client's therapeutic healing? The therapist. Exactly. Moi, right? I'm all French now. Exactly, the therapist, because it's the therapist gets triggered, right? The therapist triggered, the therapist brings their own story, their own agenda, their own this, that, and you name it, right? And that needs to be all recognized. In my training, my trauma training, a big portion is I train therapists in what I call the therapeutic seat, or the therapist seat. A lot of time is spent on how do you actually even approach the work? What do you bring into the therapeutic session? And that goes all with processed or unprocessed material of your own work, but how you engage in a relationship, how open you are, how willing you are going into the depth of the connection. And in the psychedelic work, that is acutely felt. If you are not really genuine, or if you're bored with your client, I mean, I'm making it very kind of plain right now, but if you like say, oh my God, this is so boring, or I don't like this client, or I'm getting triggered by this material because it's so close to my material, or you name it, in an expanded state, the client is reading that in a millisecond. They feel it, they sense it. And in the expanded state, they might not even make out that that's you. They're just feeling it as an energetic impact, right? Or you become a figure in their experience, in the psychedelic experience. So to be as present and as clean and as boundaried and as open and as available and as self-regulated, all of that takes a lot of training. That's really the training. The skill set of what you do, that's easy. The skill set of how you are in relation to this human being that's trying to recover from traumatic memories, that takes real inquiry and training. So Very long answer again, not to scare you, but you can do, if you have already a psychotherapeutic practice and you're wanting to add some therapeutic tools, you're already way ahead. It's wonderful. I would encourage you to do one of the trainings. Also, Embodied Lab does beautiful somatic trainings as well. They give you a lot of tools from some fantastic trainers and teachers here. So the more the merrier, that's what I'm saying. And my recommendation is always to be kind of in depth in one modality and then bring other modalities in. I think that's very helpful. So if you're like, I'm a somatic experiencing practitioner, and then I dabble around in other modalities, I'm a Hakomi practitioner, I'm an IFS practitioner. So you have a modality that you really went in deeply, that goes a long way. And then you can bring in all these other beautiful techniques as well. So that would be my answer. Is there another question? I hope that answered it. It doesn't scare you.
There are a lot of good questions in the chat, and I'm kind of toggled between two, but I think I'm gonna go with Christina's. Can people with developmental disabilities, autism, and/or those experiencing psychosis, schizophrenia, bipolar utilize these treatments?
You know what? I'm not qualified to answer that. I don't have experience with that. I wish I could say that to you. Right now, the recommendation is with schizophrenia, severe bipolar, it's recommended not to, but there's different opinions. And I think right now, because so much is focused on research and clinical studies, those are exclusion criteria actually in the studies. So I really don't have the answer for that. I know that the indigenous lens would look at it very, very differently, because that's a very different lens also on how we even look at mental illness or mental disorders in general. There's a very completely different frame for that. But then we also have to consider the role of a shaman, the role of a community, the role of these practices that are deeply sourced in culture and community and tradition and lineage and the sacred, which is, we're still learning that, right? We're still adopting that. We don't have that same kind of lineage and tradition. So I think that's going to be our task really in the Western world, of how do we bridge it and how do we bring that in. So I'm not qualified to say, yes, it's a good thing and not good thing. I don't know of any studies right now. Maybe other people know, but I don't know of any studies right now currently. I'm sure that's coming at some point. Any other question?
Yeah, maybe we can do one more. Tiffany asks, is it possible or recommended to hold psychedelic sessions with your client online, given that they are somatically prepped and resourced and work with microdoses?
That's a great question. I know a lot of people do this. I can only give you my personal experience and my personal opinion. Because I'm a somatic therapist, I even find it challenging to do somatic work over Zoom. It does work. But I found that the somatic setting, what I was just saying, just feeling and being in the presence of a therapist or guide, is no substitute for it, I think. I know that a lot of people are doing sessions, especially with ketamine online, and I think very successfully. I have not. So I don't have that experience base, and I'm sure some people would argue it works very well. The clinicians I've talked to feel strongly that it works well. My personal opinion is that when you're working somatically, when you're working with trauma, you want to be in the presence of a therapist that can do the right interventions, because fear and terror do come up. People sometimes have a shortness of breath, or they get very claustrophobic, or you name it, as they're maybe coming up against these traumatic memories. And I don't think there's a substitute for a therapist's close voice, their presence, and even maybe a safe, clean, previously consented touch. I don't think there's a substitute for that. So my recommendation is to do this work in person, especially if you're doing somatic work. So that's my personal view. Any other questions there?
Well, we have tons of questions, so we can pretty much do questions for the rest of the
Well, let me
session.
see what I had in mind here. Let me see. Let me see what I had here.
There is one that speaks to the back body practice that you often share.
Back body? Yeah.
Yeah, so I'm not really sure how to say their name, but they asked, what do you recommend for someone who is learning to become an integrative therapist to regulate their own nervous system so that they can remain calm, grounded, and
Yeah.
present.
Calm, cool, and collected. Yes. So first of all, any practice that works for your nervous system, for sure. So start there. So have a repertoire. I was going to actually guide you through a mini version of the back body practice because I like to teach it to everybody. So if you're game, I'd like to teach it to you a little bit. But what I would recommend is that you have quiet practices that you can do while you're on the work. So there's a difference between resourcing yourself prior to to doing a psychedelic work and afterwards, which I call more like maintenance and somatic hygiene. But there's a lot of stamina that you need during a guided session, and you need to use some practices that are least interfering with your client. And so they're usually of a quieter nature, so quieter breaths. And so what I often do, what I teach my students is to a combination of some mindfulness practices that are using felt sense and very internal breaths that help them to regulate their activation states down. So what you want to do is you want to have, breath practices that are not heard or obvious to the client because you don't want to interfere with their process. As I said, in an expanded state, the client is very sensitive. They kind of notice your body shifting. They notice what you're doing. They're kind of aware of it. For some clients, especially those who are quite vigilant, some clients won't notice at all. But you want to be the least interfering. So quieter breath, something that regulates your body posture, internal images that you can call up, shifting your body posture, small little micro movements. All of those things are very, very helpful to regulate your own nervous system. So that's what I would recommend. So what's not good is like to get up and do jumping jacks, or that's kind of obviously interfering. And the client's going, what's going on over there? That can be experienced quite threatening or overwhelming, or just simply interfering with their process. Clients can be very sensitive, right? They go through a very sensitive passage, maybe. It's very internal, very quiet. And so for you to regulate yourself in that moment, to stay awake, to be present, to be really alert and attuned, and to somatically be attuned, that often means that you need to work with very subtle mindfulness states. So mindfulness training is a really good training to have in general. And what I wanted to, so I hope that's helpful. And I want to kind of jump off here a little bit to also explain the Hakomi work that I'm embedded in. Hakomi psychotherapy is a mindfulness-based somatic psychotherapy. And what's beautiful about this body of work, it's been around for 40 years. And it's actually a very perfect accompanying body of work for psychedelic-assisted psychotherapy. It's based on principles, and the principles are applied mindfulness. And it's looking at how shifting the client into a mindful state and guiding somebody basically in a shift of consciousness already. So in the Hakomi work, we're shifting our clients already into a different state of awareness, which is mindfulness, and go into the depth psychology in this accessed state. So it's a wonderful training ground for psychedelic work because we're already training people in the Hakomi work how to work in a different state of consciousness. We're also training the therapist to be in their mindfulness state already and be resourcing themselves while they're working. So it's a very core principle of Hakomi is mindfulness. Another one is nonviolence. It's a very beautiful principle. And nonviolence refers to that we never go against a client's process. There is an inherent trust in the intelligence of the client's process. And our interventions are with the client, not against the client. So we don't have an agenda. We don't impose on the client thoughts or ideas that we have without a consent or really learning if this is really appropriate at this time for this client at this moment. So the nonviolence principle is a very beautiful principle because it really allows the client, we're teaching the client to deeper and deeper trusting their own emergence of what's coming up. Another principle is body-mind holism. the trusting the interconnection of the body and the mind, which again is so beautiful also with the psychedelic work, because the body and the mind are kind of very much brought together in this work, and a deep examination of also where the disconnects are. And by body mind, in the psychedelic speak here, I also mean body mind, community, life, cosmos, all of it, right? So not just body mind this way, but body mind with others. It's often a very unity kind of consciousness that arises in a psychedelic client. We have a principle called unity, which really believes in the interconnection and the interdependence of all phenomena, that what arises in the client is not an accident, it's interconnected, and it's interdependent to their life, to their experience. And even that I'm sitting in front of my client, that's no accident. That they chose me, or they, that they came to me, there's a connection there. And we trust those connections. And that all the experiences of the client is also interconnected. And with that, a frame that trauma is also, yes, a difficult, terrible experience that nobody wishes upon anybody. And yet there's a tremendous learning and wisdom and even that experience. So from that angle of unity experience, we can say that trauma even has something to offer here in our life, in our life. And that's a particular view to hold. And then we have another principle called organicity. And that's a beautiful principle, which means that organicity means we're trusting explicitly what we call the unfolding of the client's experience. And this is a powerful principle in psychedelic work, because most of the time in psychedelic work, we actually want to get out of the way of doing therapy to the client. The medicine is helping. These substances, these sacred medicines are helping and connecting the client to a much deeper source within and with life and the universe. And it's really connecting the client to this innate intelligence that everybody has. Trauma disconnects us from this intelligence. That's one of the tragedies about trauma. Temporarily, we are disconnected from that. It's not lost. We're never lost. But I want to really say that. We're never lost. And I've worked with very traumatized clients, and the experience is I'm lost, I'm disconnected. That's true. But we actually are never lost. And the beauty of these awe-inspiring psychedelic work and also awe-inspiring somatic work is that we get a direct experience. Oh, trauma happened, but I'm not trauma. Generational trauma happened. My ancestors were persecuted. My ancestors had horrible historical trauma happen. That's all true. It left scars and beliefs and woundedness and transmissions. But that's not all of who I am. And that is a beautiful message to get. And it's the wisdom part of trauma. And that's often what I found anecdotally with clients that have undergone successful psychedelic therapy work, is they come to this beautiful knowledge that the trauma happened, but they're not the trauma. So in Hakomi, we have these principles that are kind of a organizing principle, an organizing holding, in which we then allow the client to experience their present moment experience. So in Hakomi, we don't reference and we go, what happened in 1983? We're asking what's happening right now. What are you aware of in your experience right now in a shifted state of a consciousness, which we call mindfulness? And then that shifted awareness, we begin to explore how the imprints of the past, the intergenerational trauma, this life's trauma, these challenges, how they have created belief systems, limitations in the belief systems, how they've created somatic imprints, how they've kind of limited maybe life and possibilities. And then we explore and create experiences for clients to have what we call a missing experience. So we help them to have corrective experiences in which they have a different perception and a different bodily feeling in relation to that imprint or that trauma. And again, this is where the beautiful overlap happens with psychedelic work, because in psychedelics, or you have that you can visit a story or familiar, or you have an insight to intergenerational trauma with some medicines in particular. They give us beautiful insight and information to ancestral trauma. And then in the integration phase, how do we make sense of that? What does that mean that I now glimmered that I have this lineage of trauma, right? How do I make sense of this? And so in the integration sessions, we go back in the Hakomi work, we go back and we go back in the present moment. What's happening now? How are you feeling and sitting and sensing these ancestors right now? You have now access to it. You've seen them, you felt them, you've had an inkling about it in the psychedelic work. How do you experiencing them right now? Are they communicating to you? Do you see them? Is there visual? We can do a drawing. I mean, there's so many different creative ways you can play with this. So that's another way that we bridge also from the psychedelic work into the integrative work, where you have to make a new meaning of the experience. As I said earlier, we can all have a psychedelic experience, but how do you integrate it? How do you make new meaning? And how do you then create a thriving life where you let go of the trauma? Because letting go of the trauma is both understanding it, contextualizing it, but then having a new experience to that experience of trauma. That's the key factor. When somebody has a successful trauma recovery, they have tackled with some of these feelings and sensations and memories with new information. Something new is realized, acknowledged, recovered, contextualized. It comes in many different forms. We can all understand intellectually our trauma. This happened to my family, this happened to me. But the feelings and the reactions and the psychophysiological responses are often stuck. And so what both somatic work does, our Komi work does, and psychedelic work, it gives us that new experience. We have a new experience. And then we need to integrate that experience into real life. So those mystical, often in Hakomi sessions, it can have a feeling of a mystical experience right there and then without any medicines. And so what's beautiful, if people have a psychedelic reference point or that experience, when they come back into a Hakomi session, especially in the neuroplastic window, they can access that state again. Go, oh, now I feel that connection. I can feel the connection to my ancestors. I can feel where my roots are. I'm proud of my roots. Or I can acknowledge the horror of my ancestors. I can stand in that now because that's not all of who I am. I can hold it now. I let this go, or whatever this is, right? There's many, many different manifestations, how to work it then. And what then happens is that the associated feelings, the anxiety, the heaviness, the depression, the psychophysiological stuck places that people often cycle around, they begin to decrease. And that's what's so beautiful about that kind of pathway. So we have only a few minutes left. So I feel like I'm just getting going here. I hope it's not too much, but let's see if there's more questions.
Do you want me to read more questions?
Yeah, is there anything that's kind of standing out or getting a lot of
Well, all of them are so good, so it's quite hard to pick, but I'm just gonna go by what people upvote, because that tells me that's what folks want to hear answer. So this one is from Nora. Can you talk about working with disassociation in the psychedelic work?
Well, that's a very big field. Some medicines like ketamine, which is not considered a true psychedelic, it's psycholytic, and they have dissociative features. It's actually called a dissociative. And interestingly enough, in certain dosage range, it can be very effective to work with dissociation. So it really depends on the medicine. It depends on the clients. That's why I was saying preparation. Somebody who goes into ketamine treatments, they have usually a full checkup with a physician, a psychiatrist, and it's closely monitored because of the dissociative tendencies. You don't want a client to re-dissociate after an experience. But often the opposite happens. An association happens in the psychedelic work. Again, lots of preparation, right set and setting, right dosage, all of that needs to be carefully and skillfully managed. But it can have, and I say can, because again, we're still learning about all this, truly, but it can have an associative effect also. When people are having dissociative experiences, what does that mean? They had to disconnect in order to protect themselves. That's what it is. Right? They had to disconnect for protection. And the fear now associated with, I don't want to connect to this horrible feeling again or to this experience again, so therefore dissociation is my protective mechanism, can become a very ingrained psychological pattern, right? And habit and physiological pattern. So to have experiences in a psychedelic work where you have an experience of unity or connection or love or safety can be truly life-changing for people. But again, needs to be very carefully set up with a lot of skill and care. So I think it can have a lot of helpful factors here. And people need to be monitored afterwards, for sure. That's really critical. I did promise you a little bit of back body practice. Would you like to end on a moment of experiential? Yeah, okay. Because I talked rapid. There's a lot that I packed in here. There's you have all these other wonderful teachers still. This is a big field. You can find me at EmbodyWise. I'm also teacher at Embody Lab. And there's so many beautiful other teachers here as well. So there's lots more to study. Okay, if you want to find me, you can find me at embodywise.com. Let's do a moment of back body. Okay, so find a posture, an upright posture. And if you're comfortable closing your eyes or casting them down, that'd be ideal, so that you take your eyes off the screen and you come into your own body experience. Have your shoulder girdle aligned with your hips. Take a couple of deep breaths, exhaling, opening your mouth ever so slightly. Inhaling and exhaling, relaxing. Oh, with a sound. And then I'd like you to become aware of 3 places in your body: the front of your body, the center axis of your body, and the back of your body. 3, like a sandwich, like a cookie, 3-layered cookie. The front of the body is soft. The center of your body, we're going to talk about it in a moment, is going to become very fluid. And the back of the body is going to be engaged and alert, but relaxed. Allow the whole front of the body to soften. The face, the throat, the chest, the belly, all the way to your pelvis, top of your legs. Take a breath and soften it as if you had this beautiful soft membrane of the front of the body being permeable. It's safe, and you can just simply be open and soft. Now shift your attention to the center of your body. Imagine that there's an axis from the crown of your head going all the way to your perineum, your pelvic floor. There's a center that's called the central channel. And it's an energetic space that lives right in the center of your body, a vertical center, a channel going up and down, crown of the head to the pelvic floor to the crown of the head. Drop a very easy breath into that center, as if you're breathing up and down the central channel. Like a gentle wave, breathing up and breathing down. Again, soft front body. And now you're bringing a gentle breath into the center of your body. Breathing in, the breath travels up the central channel. Breathing out, it travels downward. Take a couple of breaths to really feel that fluid, soft breath traveling up and down. So you have that soft front body. You have a very soft, fluid center breath traveling up and down the central channel. And in a moment, I'm going to ask you to move into the back of your body with 1/2 of an inch or even less, a millimeter. Just moving into the back of your body as if you're sitting back into your own back, like you have yourself backed up, like a comfortable little couch. So you're engaging the back of your neck and head. You're engaging the tops of your shoulders and your trapezius muscle. You're engaging the long, strong muscles alongside the spine, all the way to your buttocks, your seat. So you're engaged, but relaxed. So you have a soft, open front, a fluid center, an engaged back body. Feel that right now. Your whole back of your body is as if you're having yourself backed up. You got yourself. And then feel both the fluidity and the solidity that arises in this posture. And then when you're ready, just open your eyes, keep your back body posture, and just notice as you open your eyes and you're letting the colors and the shapes and the light come back in, if you can access that back body. Soft front, fluid center, engaged back. And then just put a word into the chat as we're finishing here of what did that just do to you? What happened? What did you shift into? Protective, supported, centered. Yes, centered. That's right. Beautiful, pain-free, still, present, safe, beautiful, relaxed, groundedness. Yes, a lot of people describe it. Yeah, beautiful. So I only had time, keep it coming. I only had time to give you the short version, but you got the instructions to play with it. And this is really, you can take 20 minutes and if you do that in a psychedelic space or a somatic space as you're guiding your client, you will feel both that flexibility and fluidity and at the same time that solidity. And those are the two qualities that you really need for this in-depth psychological transformative kind of work. You need to be both adaptive and flexible and attuned and sensitive, and at the same time grounded, very grounded and stable, because that creates the safety that the client needs for their somatic setting. So thank you, everyone. That's all we have time for today. And thank you for allowing me to download some highlights here. I hope I see you again. Looks like there are some people that are already recognized. It's really wonderful to see your familiar faces too. And yeah, may the journey into what transforms and heals trauma continue for all of us. Yeah. Many blessings to you.
Jai. Oh, it's a pleasure, Manuela.